What your poop says about your health. Welcome everyone. Today we're talking about something that's a little bit messy but incredibly important to our health. We all do it, but few of us really pay attention to what our poop is trying to tell us. The truth is, our bowel movements can reveal more about us than we ever imagined, and tracking them will help us make necessary lifestyle changes that can improve our health and eliminate toilet struggles. So hit that thumbs button and let's dive in. Did you know that the average person has about 30,000 bowel movements in their lifetime? That's a lot of opportunities to gather valuable information on our health. Monitoring your bowel movements can help you identify any changes or irregularities that could indicate a health issue. Bristol Stool Chart. The Bristol Stool Chart provides a simple yet effective way to monitor these bowel movements and identify any changes that may indicate a health issue. By keeping track of the type, frequency, consistency, and color of your poop, you can better understand what's going on inside your intestines. This chart is meant to help us categorize and understand the different types of poop we experience. Developed by two doctors in Bristol, England, the chart classifies poop into 7 distinct categories, each with its own unique characteristics. From type 1 to type 7, the chart helps us distinguish between healthy and unhealthy poop. Let's take a closer look at each one. Type 1. Separate hard lumps, like nuts, hard to pass. This type of poop often indicates constipation and may be a sign of dehydration or a lack of fiber in your diet. Type 2. Sausage-shaped but lumpy. This may indicate that you are not fully emptying your bowels and could be a sign of weak intestinal muscles or an intestinal blockage. Type 3. Like a sausage but with cracks on the surface. Type 3 is considered normal and healthy but may be a sign of mild constipation. Type 4. Like a snake, smooth and soft. It is considered ideal as it passes easily and indicates a healthy balance of fiber and hydration in your diet. Type 5. Soft blobs with clear-cut edges. Type 5 may indicate a rapid transit time through the intestines, which could be a sign of diarrhea. Type 6. Fluffy pieces with ragged edges, a mushy stool. This type of poop is a sign of inflammation in the intestines and may be a sign of irritable bowel syndrome, IBS, or other digestive disorders. Type 7. Watery, no solid pieces, entirely liquid. Type 7 is an indication of severe diarrhea and could be a sign of an underlying illness or food intolerance. The ideal type of poop is type 4, which is smooth, soft, and easy to pass. This type of poop indicates that your diet is balanced, you are adequately hydrated, and your digestive system is functioning properly. Apart from the chart, when evaluating the healthiness of your poop, there are 3 key things to look out for: frequency, color, and consistency. Color. Normal poop colors range from light brown to dark brown and are generally caused by the breakdown of bile produced in the liver. Here are a few of the most common normal poop colors and what they indicate. Light brown is caused by an adequate amount of water in the intestines and is considered normal. Dark brown is usually a result of dehydration and can also be a sign of a diet high in iron-rich foods like red meat. While light brown and dark brown are considered normal, other colors indicate digestive issues. Green indicates that the poop is moving too quickly through the intestines and not allowing enough time for bile to break down. This could be a sign of diarrhea. Yellow. This shows a lack of bile, which is needed for the breakdown of fats in the body. This could be a sign of liver problems or gallbladder disease. Black. This color may indicate the presence of digested blood and could be a sign of bleeding in the upper digestive tract. Red indicates the presence of fresh blood and could be a sign of bleeding in the lower digestive tract. It's essential to understand that what you eat and the medications you take can both impact your stool. Eating foods with a high amount of food coloring, such as beets or berries, may make your poop appear redder. Taking iron supplements could cause it to turn a dark brown color. Antacids containing bismuth might even transform your feces black. Frequency. Frequency is all about how often should you be going to the bathroom, and what does it mean when you're not going as often or as much as you usually do. Normal frequency. When it comes to poop frequency, there's no one-size-fits-all answer. Some people may go once a day, while others may go a few times a week. But there's a general range that's considered normal, and that's anywhere from 3 times a day to 5 times a week. And if you're in that sweet spot, it's a good sign that your digestive system is functioning properly and your gut bacteria are doing their job. Abnormal frequency. Of course, there are times when things just don't go as planned. Here are some common abnormalities in poop frequency and what they may indicate. Constipation. If you're not going as often as you usually do, or if it's been more than 3 days since your last bowel movement, you may be constipated. This can be caused by a low-fiber diet, dehydration, or certain medications. Diarrhea. On the other hand, if you're going more often than usual and your poop is loose and watery, you may have diarrhea. This can be caused by an infection, food intolerance, or digestive disorder. Consistency. Lastly, let's talk about poop consistency. It's one of the most important factors in determining the health of your gut, so listen up. Normal poop consistency. Just like frequency, there is no universal definition of what constitutes ordinary poop consistency. But generally speaking, a poop that's soft and easy to pass is considered normal. It should be like soft-serve ice cream, not too hard and not too soft. If your poop falls within this range of consistency, that is a strong indicator that your digestive system is performing optimally. Abnormal poop consistency. Of course, not all poops are created equal. Here are some common abnormalities in poop consistency and what they may indicate. Hard stools. If your poop is hard and difficult to pass, it may be a sign of constipation. Loose stools. If your poop is watery and doesn't hold its shape, you may have diarrhea. Other factors to watch out for in your poop: blood in the stool, mucus in the stool smell. However, there are things you can do to fix all these poop deformities. Eat a fiber-rich diet. Fiber helps to regulate bowel movements and keep your poop soft and easy to pass. Make sure to include plenty of fruits, vegetables, and whole grains in your diet. Stay hydrated. Drinking water can help keep your poop soft and prevent constipation. Aim for at least 8 glasses of water per day. Use enough unsaturated fats, such as olive oil, like 2 to 3 tablespoons. Exercise regularly. Physical activity can help stimulate the muscles in your intestines and promote healthy bowel movements. Reduce stress. Stress can affect your digestive system and lead to irregular bowel movements. Try to incorporate stress management techniques like yoga, meditation, or deep breathing into your daily routine. Avoid foods that can cause digestive issues. Some foods, such as dairy, gluten, or high-fat foods, can lead to stomach discomfort for some people. Consider a probiotic. Probiotics are good bacteria that can help balance the bacteria in your gut, which can improve your overall digestive health. It's important to pay attention to these other factors when evaluating the healthiness of your poop. By keeping an eye out for these signs, you can catch potential health issues early and get the treatment you need. Conclusion. So, what does your poop say about your health? It speaks volumes. Your poop is a reflection of what's going on inside your body, so it's important to pay attention to it. Keep an eye on its frequency, consistency, color, and other factors. If you want to take control of your gut health, stay tuned for our next video. In the meantime, leave a comment below and let us know what other health topics you'd like us to cover.